Here's an emergency that typically comes into the office. The patient breaks off a large old amalgam. And we go ahead and you can see we've prepped that back. It's pretty much equigingival. We'll scan that with the iTero. We'll mill a restoration with our Glidewell mill. We'll polish the crown. So you got to clean the salivary impurities off of the intaglio aspect of the crown. Otherwise, your bond strengths will be affected if it's not cleaned well. Some studies will show that alcohol is okay. Acetone is really not a great choice. You do not want to etch a zirconia crown, but the best thing to use, first of all, is going to be one of the cleansers. Before that, you need to ask your lab, has your lab sandblasted or micro-etched the intaglio surface of the crown? If not, most labs will do this, then you need to have a sandblaster in the office and need to do this. It creates micromechanical retention, and you really want 50 microns or less particle size, 45 psi of air pressure. You never want to clean that surface with phosphoric acid. It's not the right thing to do. You can damage the internal surface. Once you've cleaned that internal surface, you now, especially if you're using a resin cement for your cementation, you must treat the internal aspect of the zirconia with a zirconia primer. So you've cleaned the surface with Zirclean or Ivoclean, and now you're going to prime the internal surface. Probably my go-to for years has been a Bisco product called Z-Prime. And Z-Prime gives you outstanding bond strength to zirconia, alumina, and metal restoration. It's compatible with light-cured and dual-cured resin cements. It comes conveniently in a bottle. You place a drop in your crown, let it sit for 30 seconds, air dry it, and you'll see the intaglio surface looking very, very shiny. In my office, I do have a variety of cements. And the reality is, because not one cement fits every procedure and every tooth, Bisco's Dual Link is my go-to for years for maximum retention of my crowns. So Bisco has an arsenal of cements for pretty much every indication. And why I use Dual Link is because flat out, it is a true adhesive cement. You have to use a universal adhesive like All Bond with it. The material will dual cure, but you can hit it with a light for 3 or 4 seconds and you'll get a gel state that's easy to clean. But for non-retentive preps, anterior and posterior, whether it's Emax, feldspathic, zirconia, resin, composite, or metal, this is a great choice. Now, the one thing you have to realize is that, and think about it like this, you have a second molar. Very often, second molars are going to be your shortest clinical height, and Dual Link is going to be the ideal choice. The problem is second molars are also the teeth that are the hardest to isolate. And in order to bond with Dual Link, you need ideal isolation. You need a dry prep, no moisture, nothing to get this thing to work properly. For routine restorations with decent occlusal height, Theracem makes a very, very good choice. So it's self-adhesive, no etching, priming, or bonding required. It is dual cured, so a quick hit with the light, you get a tack cure that you can peel off very, very easily. You do not have to put it in the fridge, which I think is important. Putting materials in the fridge today is annoying, and now it comes out. And if it's been in the fridge and your fridge is cold, it doesn't flow the way it should flow. So I don't love having things in the fridge. As I said, it's calcium and fluoride releasing. We have a high bond to zirconia without the use of a primer. So another advantage here. So a lot of good reasons to like this product. Here's a crown that we scanned. Our laboratory created a digital model, sent us the crown back. We cemented this with Theracem. What you see here is when I compress the crown into place, the Theracem is flowing on all sides. I hit it with the light for about 5 or 6 seconds, and now I'm getting a tack cure component. If you look here on the right, the so-called gel state that you see here on the right, you can see that I've teased it away from the margin with the Explorer just to show you how it's going to peel off in one step. I'm then going to take my floss. I'm going to floss in approximately. Again, one other clinical tip that a lot of people know, but many don't, is put a knot in your floss. By putting a knot in your floss, you can slide the floss through and make sure you don't leave any cement in between below the proximal contact.